Hi everyone, I just wanted to give you a quick coronavirus update for today, which is March 23rd. As of today, we have officially opened our Crown unit down in the old CVICU and PCIU area. So there's 16 beds down there. That opened this morning about 6 o'clock. And what we did is we moved our patients in the hospital who were testing positive for coronavirus down to the Crown unit. And then we let anybody who was still awaiting test results remain on the unit until their results came back. If they came back positive, then they got moved down to the unit. I'm not sure if that even happened. If they came back negative, then we took them off of the Crown precautions. And then also effective this morning, any patients who are coming in through the ER who are going to be a rule out coronavirus patient, they are going to the Crown unit until their test results come back. And then if they come back negative, then they can be transferred to the appropriate unit. So this is a cohort unit, which means there's going to be all different levels of care. That means if an ICU patient comes in through the ER, they are going to go to the Crown unit if we're ruling out coronavirus for them. And so we will need to have some ICU nurses down there. And that's why you received a text message from Brooks earlier today asking if anybody is interested in volunteering to be a part of that unit. You will get a bonus for working those shifts down there. And so if you're interested in doing that, then please let us know and we'd be happy to add you. However, I do want to make everyone aware there is potential that any of our team can be floated down to that unit also. So the Crown unit is ready with the right PPE. We have all of the resources down there that we're going to need to care for these patients. So I think this is going to be a little bit better setup than having them kind of spread throughout the hospital. Plus, we'll be able to contain things a little more. We are expecting that we're going to get a lot more of these Crown patients in, so we may fill up this unit, and then you'll get more information about what we're going to do at that time. And then another thing I want to let you know about is we're doing, of course, visitor screening. There is a lot of talk about the potential of not allowing visitors in the very near future, but that has not happened quite yet. But one thing that somebody has mentioned is that sometimes employees are opening doors when they see a visitor outside and just kind of letting them in to be polite. But actually, please, if you notice that, if you see somebody trying to come in a door that they shouldn't be coming in, I think you know this, but just guide them to the main entrance so that they can go through correct screening. And then one last thing is that if you use the EMS entrance through the emergency department, you need to stop doing that now because, of course, we are also doing employee screening right now, and so that's not an appropriate entrance to be coming in. And plus, with everything going on, we don't need to be bringing kind of any additional things through the ER that doesn't need to be going through there. So please just make sure that you're using an actual employee entrance and expect that somebody is going to ask you some questions, some screening questions when you come in. Please let me know if you have any questions, or if you're interested in working in the Crown unit, you can reach out to Brooks or myself, and let me know if you have any questions. Thanks, guys.